Cystic Fibrosis Foundation Compass presents Navigating CF, a series of informational videos for people with CF, their families, and caregivers. This video will help you understand the basics of drug plans and how they determine coverage and costs for CF medications. You'll find additional videos and more information in this Health Insurance for CF series on the Navigating CF playlist. In addition to medical benefits, insurance plans also include pharmacy benefits. These determine the level of coverage for prescription medications. Most people with CF require a variety of medications. Making sure you get the drugs you need begins with finding out if the plan covers each medication. And if they do, what are the factors that determine if you can get your prescription, where and when you need it? It's like a journey, so let's take the first step. Every insurance plan that covers prescription medications has a drug formulary, which is the list of medications the plan will pay for. You can find the plan's formulary on the insurance company's website by calling the company or through the employer for a job-based plan. Covered medications will differ from plan to plan, and the cost of the same medication and dosage may also vary. If your drugs are covered, most plans have a tiered structure for benefits with copay amounts that increase as you move through each tier. We'll talk about these a bit later in this video. Also, the formulary will indicate if the medication has any restrictions, such as prior authorization, where the insurance company will determine if the medication is medically necessary before paying. Many CF therapies require prior authorization. This does not always mean that the insurance company will not cover your treatment, but prior authorization denials can result in delays in getting care, additional time burden, or a lack of coverage. Step therapy is another restriction you may see. This means your plan wants you to try another, less expensive drug before they will pay for the one prescribed. For example, an insurance company may have a preferred brand of pancreatic enzyme replacement therapy and may require you to change to their preferred brand. Quantity limits restrict how much you can get at one time. And finally, certain drugs may have a limited distribution restriction. This means that there is only a small number of pharmacies allowed to dispense the drug. If a plan's preferred pharmacy is not one of the limited distribution pharmacies, the plan must allow at least one of the limited distribution pharmacies to dispense the drug. There are some important things people with CF need to keep in mind when it comes to prescription coverage. First, take a look at your plan's member handbook and summary of benefits to better understand what your costs will be for covered prescriptions. Remember that restrictions, such as prior authorization, can have a real impact on when you actually receive the medications you need. Lead time is key to preventing gaps in care. Be sure you know how claims are paid. When an employer contracts with an insurance company to pay claims, this is known as a fully funded plan. If the employer pays claims directly, it is called a self-funded plan. Employer plans that are self-funded have a lot of flexibility on what medications they add to their formulary, and they may exclude coverage for CF medications. People with CF who have employer-based coverage that is self-funded or may be self-funded should be extra aware of this and closely evaluate their plan. Finally, if your plan denies coverage for a treatment you need, there are steps you can take. The Navigating CF video, Insurance Denials and Appeals, is one resource for navigating next steps. Your CF care team and Compass can also help. The next step on your journey is to know how and where you will get your medications. First, determine if the pharmacies you regularly use are part of your plan's network. Some CF treatments may be available through a local drugstore, known as a retail pharmacy. These can be limited to dispensing 30-day supplies. Your plan may also require you to use certain chains of retail pharmacies or limit the number of fills at retail before using a mail order option. Many CF medications are considered specialty medications and have to come from the plan's preferred specialty pharmacy, which typically serves those with rare and chronic diseases. Many people with CF use multiple pharmacies, so it's important to understand your options to reduce cost and time burden. Look at the plan's policy, determine if mail order options are available, and explore ways to consolidate the pharmacies you use. Added to the mix are third-party administrators that process and pay prescription drug claims for the insurance company. These pharmacy benefit managers, or PBMs, manage your plan's formulary. So when you have problems getting a prescription covered, your plan will likely refer you to the PBM to resolve the situation. The final step on your journey is to understand the other factors that affect how much you will pay and why. This is where some key information on insurance terms can come into play. You'll find more in the Costs of Coverage video in this series. As we mentioned earlier, the cost of each medication is usually dictated by its drug tier on the formulary. The lower the tier, the lower the cost. For example, many CF specialty therapies are brand name and do not have generic options available. These treatments likely will be on a higher tier and will cost more than a lower tier generic. When a generic option is available, the plan may force you to substitute with the generic drug. What comes out of your pocket depends on your plan's deductible and copay or coinsurance structure. Keep in mind that some plans have separate deductibles for medical and pharmacy benefits. You will also have copays or coinsurance for your prescriptions. There are other factors that could affect what you pay out of pocket when you pick up your medications. Some, such as manufacturer and nonprofit copay assistance programs, can help you save money. Others, such as copay accumulator and maximizer programs, can increase your costs or administrative burden. Accumulator and maximizer programs are especially important for people with CF to understand. We cover these programs in more detail in the Costs of Coverage video in this series. You can also read more about accumulators and maximizers on cff.org. You'll find more detailed information and resources for evaluating drug plans at cff.org/insurance and in other videos in this series. And remember, Compass Case Managers are ready to help you understand insurance drug plan options and cost savings programs. Connect with us whenever you need help.